program. For more, let's bring in Senator Bernie Sanders, independent from Vermont. Senator, good to have you with us tonight.
Good to be with you.
You bet. This is a website fix. Is it a turning point? Do you feel like the deadline has been met and we're moving forward?
Well, there's no question that the federal website is making substantial progress. As you've indicated, a number of state websites and states in general are doing very, very well. So we are making progress. But I find it incredibly unseemly that at a time when our current healthcare system is dysfunctional, when we have 48 million people without any health insurance, we spend twice as much per person on health care as any other country. We're the only nation in the world that doesn't guarantee health care to all people. All that the Republicans can do is attack, and in fact, really work overtime to make sure that this modest proposal, it is a modest proposal, doesn't succeed. Imagine being a cheerleader so that people who are in desperate need of health insurance don't get it. That, to me, is just beyond comprehension.
Senator, how crucial was it to meet this deadline? I mean, 800,000 people now are being able to function on this website, 50,000 simultaneous users. These are numbers that were put out by the administration. These are numbers that have been met. And this leaves the Republicans somewhat in a box. What's their next move going to be to take it down? How big is this?
Well, it is very big in the sense that they have rooted, obviously, from the beginning for this program to fail. And what we're seeing in various states, you mentioned California, Kentucky, New York State, what we're beginning to see at the federal level is that this program can work. People can sign up and get decent quality health care at a lower cost in many cases than was previously the case, and not unimportantly, that we're going to see millions and millions of people get Medicaid, people who in some cases never in their lives had health insurance.
Yeah.
So we're making some progress. We've got to continue going forward. I think our vision has got to be a health care system which guarantees health care to all of our people at a cost that we can afford.
You know, I think it's interesting, Senator. We have another example of the public-private interaction industry working together to make this happen. I mean, the fact is the private sector played a big part in this, which debunks the right-wing bullet point that's been out there that this is some big government takeover, that the private sector has been involved in fixing this website, that the private sector has been involved in delivering a better health care system. And, of course, this idea that it might, bad reflection on government. Isn't it a good reflection on government, what has unfolded here, this interaction with the private sector?
Well, yes and no. Yes, in the sense that clearly this has been a public-private partnership from day one. Second of all, my own view is that long-term, and I got to be honest with you, I believe in a Medicare for all single-payer health care system, which I think will be much more cost-effective. I think to a large degree, the function of private insurance companies is not to provide quality, cost-effective health care, but to make as much money as they can.
Well, I guess my point
is not the Obama.
I'm with you on that, on universal health care and Medicare for all. I just find it ironic that the Republicans are out there talking about the private sector, complaining about it, yet the private sector played a key role in fixing this. The bottom line, the guidance came from government, from the people who wanted something fixed.
You know, you're absolutely right on that, Ed. And the other point that I would make is when you have 48 million people who before Obamacare had no health insurance at all, what is the Republicans' position? What is their solution to the fact that we spend so much more than any other country? Their solution is to end Medicare as we know it, transform it into a voucher system, give a senior citizen $8,000 and say, good luck, make massive cuts in Medicaid. And you're even seeing in states around the country now, Republican governors whose states could have free Medicaid for 3 years. Doesn't cost them a nickel. For all of their low-income people, they're saying, no, we don't want it. So what is very clear about this whole situation is the Republicans have nothing to say.
Yeah.
All they can do is play the anti-Obamacare card and hope that it fails, and they're going to lose on that.
Now, paralleling it back to the Alabama-Auburn football game about never giving up. This was one game in one season. There's going to be another season in another game, and the Republicans are going to never stop playing it because they have gone after the entitlement programs, the big three, Medicare, Medicaid, and Social Security. So for Americans to see this through, not only are they going to have to do the due diligence of this time and time again, but it's to stay focused to see this thing through. Who's going to win out here, Senator? At this point, who's going to win out?
Well, Ed, you're exactly right. What the Republican nightmare is about is that you have the Affordable Care Act working, people saying, thank you, that I'm getting better quality care for lower costs, people saying, thank you, I'm getting Medicaid and health insurance for myself and my kids for the first time in my life. Thank you, thank you, thank you. That is exactly the Republican nightmare. And I think at the end of the day, we win, they lose, and I think you're going to see a whole lot of people saying, this is an important step forward, although we have got to go further.
Senator, I know you've been quoted in some articles and other places, but I'd like to ask you for the first time if you could talk to our audience here on the Ed Show. What are the possibilities of you running for the Democratic nomination or an independent nod to be a presidential candidate?
Well, Ed, this is what I have said. There are enormous problems facing this country. You and I have talked about them. Income and wealth inequality, massively high unemployment, the fact that we're the only country in the industrialized world which doesn't guarantee health care to all people, global warming. It seems to me it would be a real disgrace if we had a campaign where those issues, the needs of working families, the needs of the middle class, the needs of the elderly, were not front and center. We need people out there fighting for ordinary people and not simply taking huge campaign contributions from the wealthy and the powerful. What I have said is that candidate is needed. And if somebody else doesn't step up, I am prepared to do it.
Senator Bernie Sanders, great to have you with us on the Ed Show. Hope you had a nice holiday. Thanks so much, Senator. Appreciate it. Remember to answer tonight's question there at the bottom of the screen. Share your thoughts with us on Twitter at Ed Show and on Facebook. We certainly want to know what you think. Coming up,